After reading this module, you will be able to learn about personal identification, various dental anomalies, and the significance of dental anomalies in personal identification. First of all, let us see what is personal identification. The analysis of dental remains can provide information pertaining to the age of the individual as well as identity through comparison to ante-mortem records. Teeth are amongst the most resilient structure of the human body. As such, forensic odontologists are often called upon to undertake an examination of dental structures in order to establish an identification of remains based on the comparison of dental records. The dental identification, it depends mainly upon the comparison between records of the missing person and the findings in the bodies in relation to the restorative work, unusual features, and the comparison of ante-mortem with post-mortem. So students, before starting the significance of dental anomalies in personal identification, let us just study the basics of personal identification. The identification of a person or dead body means the recognition of the person or dead body. It is based on the certain physical characteristics that is unique to that individual only. It may be complete or it may be partial. The complete identification means the absolute fixation of the individuality of a person, whereas partial identification, it refers to the ascertainment of only some facts. For example, it can give detail about the race of a person, sex of a person, age and stature of a person, while the other factors, they remain still unknown. When we talk about the personal identification, the next question arises where the personal identification is required. So here is the answer. In the dead, identification is required in cases of fire, explosion and different kind of accident. It is also required when an unknown dead body is found and it requires identification. Accurate identification is mandatory for establishment of the corpus delicti after homicide, since the unclaimed bodies, portion of the dead body or bones are sometimes brought forward to support a false charge. The term corpus delicti, it refers to the body of the offence, that is the essence of crime and not the physical body of the victim. And in the case of the homicide, it includes the positive identification of the body and proof of the death by a criminal act of the accused. The point which are considered for the establishment of the identity, they include race of a person, religion of a person, sex of a person, age of a person, gender development, and lastly, different kind of congenital features. For example, personal appearance and anthropometric measurements. So students, in this chapter, we will focus on the dental anomalies and their significance in personal identification. Let us see what is forensic odontology. C.K. Parikh, in his textbook of medical jurisprudence, forensic medicine and toxicology, he stated that forensic odontology, it deals with the science of dentistry, especially the examination of teeth as it relates to the law. The subject normally concerns with the identification of person from data of their teeth pattern, and it also concerns with the investigation of the criminal cases where bite marks are involved and the identity of the biter is sought. The teeth, they also provide evidence as to the age of the individual which helps in establishing his personal identity. It also helps in establishment of his general facial characteristics and his economic status from the condition of the teeth and type of the dental repair. And sometimes it also tells about the occupation of a particular individual. Loss of teeth due to the assault, it constitutes the grievous hurt. Teeth help in establishing identity because each adult has 32 teeth with 5 surfaces, each with their own characteristic of shape, size, position and spacing, with the result that no two sets of the teeth are exactly alike. Teeth extracted after death, they leave a completely different socket from those removed during life. When a tooth is removed or dental work of any sort carried out, the teeth pattern is changed and its record may exist with the dentist. In the natural decomposition, teeth are practically indestructible. The identification from the data of authenticated teeth, it depends entirely upon the accuracy and completeness of authenticated records which are made during the life of an individual. The records which is recorded, it includes the number and situation of the teeth that are present. It also includes the number and situation of the teeth that are lost, including evidence of how long they have been lost. And the records include the arrangement, irregularities, any kind of erosion, caries and fillings. In addition, it includes the bridge, crown work and any kind of denture, that is artificial teeth. Lastly, the record also consists of the exact shape of the edentulous jaws. A dental radiograph, when available, it constitutes one of the most valuable pieces of evidence for identification purposes. Panorex X-ray technique. This technique provides the excellent pictorial dental record that is easily understood by laymen. The computer assisted post-mortem identification, that is CAPMI. This system compares the dental records of the victims of mass disasters and enables the rapid identification of air crash, flood and explosion victims. Some of the common identifying features of the teeth, they pertain to the faulty development, faulty alignment, presence of stains, localized wear of certain teeth and missing teeth. First, we will talk about the faulty development. Teeth may be undersized, oversized, notched or present some other irregularity as a result of faulty development and malformation. Hutchinson's teeth, they constitute a classical example of malformation of the incisors in congenital syphilis. The changes are most conspicuous in the central incisors, which are usually small, widely spaced, notched and less broad at the cutting edge than at the gum margin, giving them the appearance of the tip of the screwdriver. Next, I'll tell you about the faulty alignment. The defect in the alignment of teeth may be present in the space between the teeth, for example, widely spaced teeth, overriding teeth, and it could also be present between the teeth of upper and lower jaw. When there is a protrusion of upper incisors resulting in the overlap of the lower incisor, the bite pattern is known as overbite. The reverse pattern is also known as cross bite. Next, you will be knowing about different kind of teeth stains. Pen chewing habit stains the teeth with dark, brown or black deposit. yellowish or dark brown stains on the back of the incisors. They are the most common in the cigarette smokers. Chalky white or yellowish brown areas of discoloration, striations and mottling on the enamel are found in the fluorosis, where the person is taking excessive fluoride. Metal poisoning may also cause pigmentation of the gums and thereby it suggests a cause of death. Copper causes a green and mercury and it led a blue-black line on the gums. Gum hypoplasia included by the phenytoin may aid in the identification and it also suggests the epileptic seizure as a cause of death. The next we will discuss localized attritions. A pipe smoker, they have localized wear of teeth either on the incisor or at the angles of the mouth due to the position of the pipe. Notched incisors from holding thread, pins or nails between teeth on a day-to-day basis may suggest that a female was a tailor or she was a hairdresser or a male was a cobbler. The next abnormality is the missing teeth. In the decomposed bodies or in the skeletal remains, the teeth commonly loosen from the bony socket and they are found in the surrounding soil. Such displaced teeth should be saved and they should be properly labeled. Now, we will talk about different kind of dental anomalies. First, I will tell you what the dental anomalies is. Dental anomalies is defined as the abnormality of the form, function and the position of the teeth and the associated structure. Identification of human is also supported by forensic odontology and anthropology. In many cases, when the soft tissues are destroyed, carbonized or absent for whatever reason, bones and teeth, they become the only source of information. It also tells about the identity of the deceased. Anything that is different in human dentition will help in the identification of an individual, such as variation from normality. It becomes an important tool when trying to establish the identity of the disease. Thus, there are many anomalies which are classified according to their size, number, shape and structure. Next, you will be knowing different kind of development disorders of the teeth, and these disorders include anomalies of size such as Micro Danxia and Macro Danxia. The disorder of the shape of the teeth include germination, fusion, concrescence, dilaceration, Talon cusp, dense indent, dense evaginatus or taurodontism. Whereas the development disorders also include the disorder of number of teeth such as anodontia, supernumerary teeth, predeciduous dentition and post-permanent dentition. Lastly, the anomalies of the structure of teeth, it include MLEOGenesis Imperfecta, environmental Enamel Hypoplasia, DentinoGenesis Imperfecta and dentine dysplasia. First, we will talk about the anomalies of size. Depending upon the size of the teeth, the anomalies of the teeth, they can be classified into Micro Danxia and Macro Danxia. Micro Danxia is a term that is used to describe the condition in which a single tooth appears to be smaller than the normal size of teeth, that is beyond the limit of variation. This Micro Danxia is again divided into three types. First is the true generalized type. In this condition, all the teeth are well developed and smaller than the normal but small in the size. The second type of Micro Danxia is relatively generalized. In this condition, teeth are normal or slightly smaller than the normal teeth within the range of size of teeth, but the jaw size is slightly larger than normal and it gives an impression of Micro Danxia. The third category which is included under Micro Danxia is involving a single tooth. It is also referred to as localized Micro Danxia and it affects the maxillary lateral incisor and the third molar. In this case, only 1 or 2 teeth are small. The next anomalies which is based on the size is Macrodontia. Macrodontia is a condition in which teeth are larger than the normal, beyond the usual limit of variation. Similar to the Microdontia, can be again divided into two conditions: true generalized Microdontia and relative Macrodontia. The true generalized Microdontia, it is a condition where the jaw of the person is of normal size but all the teeth are abnormally large. It is a rare condition and it can occasionally be seen in people with pituitary gingivitism or excess of growth hormones. Whereas in case of relative generalized Macrodontia, the teeth are normal sized but the jaws are small. Hence, the teeth are generally relatively larger in comparison. This is due to the result of inheritance from each of the parents, where the size of the teeth can be inherited from one parent while the size of the jaw is inherited from another parent. Hence, it is not uncommon for parents who have straight, even teeth to give birth to the children who have crooked teeth. Next, we will talk about the anomalies of shape. The first condition is the germination. It is the dental phenomena where two tooth appears as they developed from one tooth and having only one root. The second type of condition is fusion. The fusion arises because of union of two separate tooth and it is the anomaly of shape in which tooth count is normal. The fusion can be complete or incomplete depending upon the stage of development. The third type of condition is concrescence. It is the condition where the cementum that overlays the root of at least two teeth and join them together. Next, I will tell you about the dilaceration. It is a shape anomaly in which tooth shape and its structure is changed in angular form, such as they show a sharp bend in the tooth which can be present in the crown portion or in the root portion. It is not present in the fully formed teeth. Mainly, it is due to any kind of injury or trauma during the eruption period of tooth. The next condition is the talon cusp. It is the anomalous structure like eagle's talon which projects from the lingual and facial structure of teeth. The next type of anomaly is dens invaginatus. It is the development aberration of a tooth which results in the appearance of an extra bump or extra cusp on the tooth and it is usually seen on premolar surface. The next type of condition is peg laterals. It is an anomaly that is related to the small and peculiar shape of the lateral incisor. The mesial and the distal surface converge to the top, forming a cone-shaped crown with the roots being shorter than the normal. The next type of anomaly is the Chauvel incisor. From the side of the palate, the edge of the incisor is curved towards the palatal surface due to deposition of enamel. It refers to the lingual extension of the lateral border of the incisor teeth. The next condition is the Protoss eyelid. It refers to a condition where an extra cusp appears on the buccal surface of the mandibular first molar. Now, you will be knowing about different type of anomalies of the number of teeth. The first is Anodontia. It is a genetic disorder that is commonly defined as the absence of all the teeth, and it is extremely rarely encountered in a pure form without any associated abnormalities. It can be partial or it can be complete. That is the condition where the number of tooth is less than the normal. The next type of condition is HypoDanza. It refers to the presence of extra teeth than the normal or common normal, that is also known as supernumerary teeth. It is genetic in origin and the most common location in between two central incisor, and since it is between central incisor, it is also known as mesodens. Another common location is after third molar, and this condition is known as paramolar. The next condition is AllegoDanza. AllegoDanza is genetic in nature, and this term is most commonly used to describe the condition in which more than 6 teeth are missing. Now, you will be studying about the anomalies of structure. First, I will be telling you about the MLEOGenesis Imperfecta. It is the defect of enamels which is hereditary in nature. It is ectodermal disturbance since the mesodermal components of the teeth are normal. Development of the enamels occurs in 3 stages. The first is formative stage, second is calcification stage, and the third is the maturation stage. The second type of anomaly is environmental enamel hypoplasia. It is defective formation of the organic enamel matrix of the teeth. There are many environmental factors which are responsible for causing enamel hypoplasia, which include nutritional deficiency of vitamin A, C and D, hypocalcemia, birth injuries and congenital syphilis. So students, now you will be studying about the forensic significance of these dental anomalies. Dental identification is the most sophisticated method of comparative identification except dactylography. If there are some features to compare and some records of those features in a missing person. Teeth and jaws are usually projected from fire and mechanical trauma, and these are highly resistant to post-mortem destruction and decomposition. Dental findings establish the identification of single individuals after accidental death or homicide, and after differential identification of large number of individuals after mass disaster such as explosion, house fires, aircraft accidents, earthquakes and shipwrecks. Teeth are useful in determining the sex and blood group from the cell pulp cavity. Loss of the tooth due to assault is grievous hurt and it can act as an identity of any person. Denture, partial or complete are useful in identification, especially if they have patient's name or code number included in them. Bite marks can work as circumstantial evidence and can help in linking the criminal with the crime. So students, now let us see what we have studied in this module. The dental identification depends mainly upon comparison between the records of the missing person and findings in the bodies in relation to the restorative work, unusual features and comparison of ante-mortem with post-mortem. Identification of a person or dead body means the recognition of the person or dead body. It is based on certain physical characteristics unique to that individual only. It may be complete or it may be partial. Forensic odontology deals with the science of dentistry especially the examination of teeth as it relates to the law. The subject normally concerns with the identification of person from data of their teeth pattern and the investigation of the criminal cases where bite marks are involved. The identification from data of authenticated teeth depends entirely upon the accuracy and completeness of authenticated records which are made during life. Some of the common identifying features of teeth pertain to the faulty development, faulty alignment, presence of stains, localized wear of certain teeth and missing teeth.